These photographs offer a stark and compelling glimpse into the nascent days of neurosurgery, a time when Dr. Harvey Cushing, a pioneer in the field, was pushing the boundaries of medical knowledge at the Peter Bent Brigham Hospital in Boston. Cushing meticulously documented his cases, amassing a collection of over 2,000 glass plate negatives that now reside at the Yale University Library. What we see here isn't just a medical record, it's a human story, etched in the faces of those who bravely faced the surgeon's knife. Notice the rudimentary surgical instruments. These tools, though seemingly primitive by today's standards, represent the cutting edge of technology in the early 1900s. Cushing's innovations, such as the use of local anesthesia and meticulous hemostasis, the control of bleeding, drastically reduced mortality rates for brain surgery, a procedure previously considered incredibly risky. Look closely at the patient's head bandages. These are not the sterile, pre-packaged dressings we're familiar with today. Often made of gauze and soaked in antiseptic solutions, they were painstakingly applied and changed. The bandages speak to the post-operative challenges faced by patients, including infection, a significant threat in the pre-antibiotic era. Cushing's meticulous record-keeping allowed him to track infection rates and refine his surgical techniques. The expressions captured in these portraits reveal a complex mix of emotions, apprehension, resilience, and perhaps a glimmer of hope. Many of these individuals suffered from acromegaly or pituitary tumors, conditions that cause dramatic physical changes and often debilitating symptoms. Surgery, though fraught with risk, offered a chance at normalcy, a chance to reclaim their lives. Cushing's photographic archive wasn't merely a clinical tool. It served as a powerful teaching aid, allowing him to share his groundbreaking techniques with other surgeons. His detailed case studies, accompanied by these striking images, transformed the field of neurosurgery and laid the foundation for modern practices. These photographs, therefore, are not just portraits of patients, they are portraits of a medical revolution in progress, a testament to the courage of both the patients and the surgeon who dared to venture into the uncharted territory of the human brain. They remind us of how far we've come and the debt we owe to those who paved the way. Let's delve deeper into the world of Dr. Harvey Cushing and the medical landscape he inhabited. These photographs reveal more than just medical conditions. They offer a window into the social and scientific context of the early 20th century. Observe the attire of the medical personnel. The long white coats, though now ubiquitous, were a relatively recent addition to the operating room, reflecting a growing awareness of hygiene and antiseptic practices. Prior to this era, surgeons often operated in their street clothes. Cushing, a staunch advocate for sterile techniques, championed the use of surgical gowns and gloves, contributing to the standardization of surgical attire that we recognize today. Notice the absence of female medical professionals in these images. While women were increasingly entering the nursing profession, their presence in the operating room remained limited. This reflects the gender dynamics of the time, where surgery was largely considered a male domain. It's important to acknowledge that the narrative presented in these photographs is incomplete, as it excludes the contributions of the many nurses and other support staff, often women, who played crucial roles in patient care. The starkness of the operating rooms depicted in these photographs speaks volumes about the limited resources available at the time. Specialized equipment like electrocautery or sophisticated imaging technology were yet to be developed. Cushing relied heavily on his meticulous surgical skills and anatomical knowledge, often working under challenging conditions. These images underscore the ingenuity and resourcefulness that characterized early neurosurgery. Consider the societal impact of conditions like acromegaly and pituitary tumors. These disorders, often resulting in visible physical changes, carried significant social stigma. Patients faced prejudice and misunderstanding, further isolating them and impacting their quality of life. Cushing's surgical interventions offered not only physical relief, but also a chance for these individuals to reintegrate into society. The detailed record-keeping evident in these photographs reflects Cushing's commitment to advancing medical knowledge. He meticulously documented each case, correlating clinical findings with surgical outcomes. This meticulous approach transformed neurosurgery from a largely exploratory field into a data-driven discipline. His work laid the foundation for evidence-based medicine, a cornerstone of modern healthcare. These images also reveal the human cost of medical progress. While Cushing's innovations drastically improved outcomes, not all surgeries were successful. The photographs serve as a reminder of the risks and uncertainties that patients and surgeons faced in this pioneering era. They also highlight the importance of ethical considerations in medical research and practice, a conversation that continues to this day. Through these images, we gain a deeper understanding of the complexities and challenges that define the early days of neurosurgery, a field that continues to evolve and push the boundaries of human understanding. Continuing our exploration of Dr. Harvey Cushing's photographic legacy, we move beyond the operating room and into the realm of long-term patient care and the evolving understanding of neurological conditions. Examine the post-operative photographs. These images, often taken weeks or months after surgery, document the patient's recovery and the long-term effects of their conditions and treatments. They offer valuable insights into the challenges faced by patients as they navigated the often arduous process of healing and rehabilitation. These images also underscore the importance of follow-up care, a concept that Cushing championed, recognizing that surgical intervention was just one piece of the puzzle. Notice the subtle changes in the patient's expressions in these later photographs. While some faces reflect relief and gratitude, others reveal lingering traces of pain or the emotional toll of their experiences. These images remind us that behind every medical case is a human story filled with complexities and nuances. Cushing, despite his demanding schedule, recognized the importance of the patient-physician relationship, and his meticulous records often include detailed notes about individual patients' personalities and circumstances. The photographs also shed light on the evolving understanding of neurological conditions. In Cushing's time, many of the diseases he treated were poorly understood. His meticulous documentation, combined with his detailed anatomical studies, contributed significantly to the advancement of neurological knowledge. The images, therefore, serve as a visual record of the progress made in understanding the complex workings of the human brain and the diseases that afflict it. Consider the impact of these photographs on medical education. Cushing's extensive collection of images and case studies became invaluable teaching tools, not only for his own students, but for surgeons around the world. His meticulous approach to documentation set a new standard for medical record-keeping and helped to establish the importance of visual aids in medical training. These images, therefore, played a crucial role in shaping the next generation of neurosurgeons. The preservation of these glass plate negatives is a testament to their historical significance. The delicate process of digitizing these fragile images has allowed them to be shared with a wider audience, ensuring that Cushing's legacy continues to inform and inspire. They provide a unique window into a pivotal period in medical history, a time of rapid advancements and profound change. Finally, these photographs serve as a powerful reminder of the human element in medicine. They humanize the individuals behind the medical diagnoses, reminding us that each patient represents a unique life story. Cushing's photographic legacy is not simply a collection of medical images, it's a collection of human stories, captured in a moment of time, reflecting the courage, resilience, and vulnerability of those who faced the unknown in the pursuit of healing. Through these images, we gain a deeper appreciation for the complexities of medical progress and the enduring power of the human spirit.